Hello everyone, I am Dr. Hasan Alobaidi. I am a Chief of Urology Department in Al Furat Medical Hospital and an andrologist in Al Sadr Medical Hospital. I'm pleased today and I'm very honored to sit with the legend in our field of prosthetic urology, Professor Steven Wilson. A few glimpses about Professor Wilson. He performed more than 11,000 cases of penile implant surgery in more than 53 countries. So he's the most experienced penile implant surgeon in the globe. Welcome, sir.
Thank you. And actually, Anas, it's 60 countries now.
Now, within the last 2 years, maybe?
Within the last 2 years, I picked up 6 more.
6 more countries.
Including your country of Iraq.
Yeah. So, Professor, since that you have achieved more implants than anyone in the globe, with that thousands of cases, what do you think the most transformative step in penile implant surgery? You have been in the 70s, you have been in the 80s, and now you are still doing implants. What is the most significant step, or let's say the turning point in penile prosthetic surgery?
I think the most transformative thing that's happened with penile implant surgery is that, first of all, it's been around 50 years. And in the old days, we made the patient get on a treadmill and go from test to test to test before we gave up on medical therapy and did surgery on him. Now, 50 years later, we don't do any of that anymore. We prescribe one of the impotence pills, which are called phosphodiesterases, for the patient. If he comes back and he says it doesn't work, or I don't like the side effects, we don't force him to have more tests. We just say, okay, it's either going back on the couch and watching TV, or you can have a little minor surgery done as an outpatient, 30-minute surgery through a 2-inch incision, and get your life changed and get your erections back.
Mm-hmm. And maybe 5 years ago, the EAU guidelines and the AUA guidelines were heading about stepwise management. And I think within the last 5 years, if he failed one treatment, like medical treatment, he doesn't need to go to ISWITs. He doesn't go to vacuums. He can jump right into surgery.
Exactly. I think our only responsibility as a surgeon is to inform him of these other therapies that basically 75% of guys don't want to do. They don't want to put their penis in a canister and suck the air out of it. They don't want to stick needles into their penis and give themselves injections. So if they say, I've considered it, doctor, and I don't want it, then we move immediately to surgery. And so that, in a nutshell, Anas, is what's really happened that's transformative.
Mm-hmm. So since you operated with all the devices from Coloplast, from Boston, and recently with Rigicon, what do you think the, let's say, the long-term implant success as a device?
Well, first of all, the penile implant has been around 50 years, and over the years, the manufacturers have continually enhanced it to make it less likely to get infected and less likely to break mechanically and have to be fixed with a second surgery. As a matter of fact, it's one of the most dependable implants placed in man. That means that it's less often have to be operated again in the patient's lifetime than breasts, knees, hips, heart valves, you name it. So it's a very dependable device, and that means that all 3 companies are working hard to keep it dependable and to keep it from getting infected. So with respect to safety, it's a very safe implant, and any manufacturer that you choose will be something that you can pretty much say, I'm not going to need another surgery in my lifetime.
Mm. But in young patients, sometimes I tell the patients that you might need to exchange your implant in like 10 years, 12 years. What do you think about that?
Well, but you know, to be honest with you, the chances of having to exchange it in 10 years is only 23%. So that's pretty small, which means, on the other hand, that 77% of them are still going strong at 10 years.
Yes. So in Iraq, we have implanted only one case in 2021, and we have implanted 75 cases in 2024. And our goal this year is to go plus 100. What do you think of local champions like us to increase the awareness, the global awareness about penile implant surgery?
Well, first of all, I think Iraq is lucky to have somebody like you, because we know for sure that if there's publications that have proved that if the doctor does more than 31, he's less likely to have problems. So 31 is roughly almost 3 a month. You're doing right now 75 and hoping to get to 100. If you get to 100, you will be, from little bitty Iraq, you will be in the top 20 implanters in the world, which is quite an accomplishment for someone so young.
So in a skeptical and conservative society, like in Iraq and the Middle East, we have a lot of patients are skeptical about the cost, myths, complexity of inflatable penile prostheses. So how do you counsel such patients?
Well, that's a really good question. And I think the key to making patients feel comfortable is that they have to walk out of your office knowing 3 things. Number one, they have to know how much it's going to cost. You cannot mystify them and say, well, we'll put you in the hospital. If all goes well, it'll be this. But if something goes wrong, I don't know how much it's going to cost. You've got to give them a turnkey price. And like you do, and you've got to have the hospital and everybody on board that that's all it's going to be. So price is always very, very important. The other thing is that it is invisible in your body. A lot of patients think this is going to be like some sort of scaffold on their penis to make it hard, but no, it's totally invisible. You could take a shower in the locker room in front of 10 men, nobody would know you had it. If you don't tell your sexual partner you've got it, she'd never know. Now, she might get suspicious because you can keep it up all night.
Yeah. So,
and the third thing is that it's natural. It's all we're doing with a penile implant is giving a man an erection that he can't get because he has inadequate blood flow, and so it's completely natural. If you're able to have a climax and ejaculate, and you're going to do the same thing with a penile implant because all we're doing is giving you the stiffness, and the stiffness is terrific. It's just as good, and in some cases better, than what you had as a natural.
Yeah, actually, I had a patient like 7 days ago, and he was very happy. He said, "You gave me confidence. I have done the surgery 3 years ago, and he's very happy. He gained confidence, and he was visiting me because of ejaculatory, because they are diabetics. They always, sometimes they have retrograde ejaculation, delayed ejaculation, that's why. So what about the patient with unrealistic expectations? So in our clinic, we have a lot of, young patients that just are seeking for the longest penis that they can get and the girthiest penis. So have you had...
Well, that guy's out there, and I'm sure that guy's watching today, and I want to tell that guy, you're not going to have a bigger penis than you had that the one God gave you. I mean, it's just that simple. We don't make it any bigger. We do make it harder, but we don't make it any longer. And so you're going to get what you previously had. And if you're older and you've gained weight, you're not going to have as long a penis as you did when you were 29 years old. And so we say that for every 35 pounds a man gains, he loses 2.5 centimeters of length. And so one way to get more length is to lose some weight, but at 35 pounds is not easy to lose.
That brings us to a point. I see a lot of patients with Peyronie's disease, with arterial insufficiencies. They delay their surgeries for about 2 to 3 years. And they should get the surgery the right way. Why do you think men delay their surgery?
You know, I used to, when I was in practice, I had a book that I had written for men and their partners, and I would advertise it in the newspaper that it was free because I'd hoped that they'd read the book and then they'd come see me and I could fix their problem. And so about once a month we'd have an ad, send in this coupon for a free book from Dr. Wilson. And we would get those coupons, and we secretly on the coupon had a date on there that it was in the newspaper. And the amazing thing is that the majority of patients that sent the coupon in, most of them were worn and folded, and the guy had had it in his billfold for 1.5 years trying to get up enough nerve to go see the doctor. So you're right. Why do they do it? Because it's an operation and they're scared of surgery.
Yeah. So it's the same thing, even in Western societies, the same. Maybe it's the shame, maybe it's denial. We don't know. And we encourage patients to have their surgeries as soon as possible, because if they do, they will not lose centimeters of their penis anymore.
And it's like being on a treadmill. I mean, there's an old saying that who wants to play baseball if you're going to strike out? So they know they're not going to, so they lose interest in their wife, they become depressed, they don't take care of themselves. It's just an overwhelming thing that happens, and it's so easy to fix with a little 2-inch incision and a minor surgical procedure. You're back to normal in 2 or 3 weeks. It's amazing.
Thank you, sir. So I want to get back to the surgeons. What do you think the difference between a good surgeon and a true exceptional surgeon in penile prosthesis surgery?
Well, I know for sure that the more of these operations you do, the better you get at it, because it's done through a tiny little incision, so the patient doesn't have a lot of discomfort. But it's tricky, risky surgery, and you need to have done it frequently for quite some time to get really good at it. And so the more a patient looks for somebody who specializes in this field, the better off he's going to be. The less complications are in those guys that do a lot of penile implants.
Mm-hmm. And what do you think about the exposure of a surgeon to, international leaders, mentors, experts? Is that beneficial for the patient?
It's very beneficial because, for example, somebody like you in a Middle Eastern country where this has only recently begun, if you go to international symposia, you meet doctors from the United States, doctors from Spain and France, where for 50 years we've had doctors doing these things. And so you learn a lot by just networking with those doctors.
They're doing the surgery like for 50 years.
Yeah. And you're like on an island. If you have a problem, thank God we have cell phones that go outside your country, because you have nobody in your country that has the experience that you have. So for sure, going to international symposia and networking with physicians and attending the seminars is vastly beneficial for you.
Thank you, sir.
And of course, your English is excellent, so it's easy for you. But imagine if you were in a country and your language was not common and you didn't know English. So you're stuck. You're on an island. You got nobody to talk to, nobody to ask advice from.
Actually, this is the key to get internationally known and to engage with the experts. You need some potential to get there. One last question. What do you think in the near future a technique or an approach to substitute the penile prosthesis?
There's just absolutely nothing on the horizon. If the penis is sick, we can give it medications. But if it's really broken, there's nothing except this surgical implantation of a penile prosthesis that's going to fix it. And there's nothing in gene therapy that I know about. There's nothing in any other form short of a medical device being implanted. It's just not there.
That's a good thing for us, the penile implant surgery.
For sure.
So it's a true honor to be here and to gain those precious moments with the legendary Professor Steven Wilson. And actually, I think what we do as surgeons is not just surgery, it's getting and restoring confidence and dignity for men. We share one goal is restoring lives. And thank you, sir, for inspiring young urologists like me to be proceeding with this field. Thank you, sir, for your time.
You're very welcome. I should also remind the audience that you are a demon for acquiring knowledge. For example, we had a meeting on prosthetic urology in the United States. I never thought he could get a visa. And he worked and worked. I was so lack of confidence that you would get the visa that I had a kid from Turkey going to take your place. He was all set, had his bags packed, and you got the visa. Dr. Anas applied for a fellowship. There's only 3 in the world. We had many young doctors around the world apply, and we only had 3 slots. He got chosen. The Korean visa for Iraq is even tougher than from the United States, and he got over there. And again, I had an alternate lined up, another disappointed young man. So congratulations.
Thank you, sir. Thank you for your follow-up and support.